right, so this has been our session on the changing brain, and I'm going to reflect on what would be the steps toward dietary and physical activity recommendations. And for those of you who came in a little bit later, I'm Mary Ann Johnson. I'm in Foods and Nutrition and Gerontology at the University of Georgia. My disclosures are here related to grants, gifts, consulting, and investments. And I'd like to reflect with you on some of the research findings we heard today. And overall, why does the role of exercise and nutrition and brain function matter? And given the state of the science, what recommendations can be made? And then I'll turn it over for some next steps to our scientific experts so we can have a Q&A and get some more of their insights. Well, our research findings are amazing. We had Dr. Von Praag from NIA, Dr. Hillman from Northeastern University, and Dr. Leia from University of Bordeaux. And we've heard about neurogenesis and brain plasticity, exercise fitness, adiposity, brain health, and cognition in our school-age children, and neuroinflammatory processes in the brain, and nutrition related to fatty acids and early in development. Well, why does the role of exercise and nutrition and brain function matter? Well, it matters from very early life and early life and into late life. And I've got my husband and my daughter up here, one who is in school and one who wants to maintain his healthy brain as absolutely long as possible. So as a few examples, we heard about academic achievement alluded to by Dr. Hillman today. As people get older, many develop mild cognitive impairment, which for some people is a precursor to Alzheimer's disease and other dementias. And these are memory and cognitive problems. So not attaining or unable to maintain our full cognitive function is costly in dollars and in quality of life. So as an example, I'd like to use Alzheimer's disease. And these are some recent data from the Alzheimer's Association, where in the U.S. the prevalence of Alzheimer's disease is currently over 5 million people. The vast majority are older people. And this is projected to triple by 2050 to 16 million Americans. And interestingly, since 2000, deaths have decreased by 14% from heart disease and increased by 89% from Alzheimer's disease. And Alzheimer's disease is now the 5th leading cause of death in the state, even ahead of diabetes. So what are the costs of Alzheimer's disease and other dementias? In 2016, it is estimated that more than $230 billion was the value of unpaid assistance from family and friends, mainly for caregiving. In 2017, it's estimated we'll spend nearly $260 billion that are payments for health care and long-term care, and 67% of this comes from our federal programs, Medicare and Medicaid. And by 2050, it's estimated that we'll be spending over $1 trillion annually in payments from our government programs. If they're still the same ones we have now, that would be Medicare and Medicaid. So staggering costs for this one aspect of cognition alone. So could nutrition or exercise delay onset and decrease the cost of Alzheimer's disease? Well, carrying on with this theme of prevention, Zissimopoulos took an economic approach and ran economic analyses and said that medical advances that delay onset of Alzheimer's disease for 5 years result in about a 40% lower prevalence and 40% lower cost of Alzheimer's disease by 2050. And this 5-year delay in Alzheimer's disease in individuals could lead to nearly 3 years additional life years and nearly 5 additional Alzheimer's disease-free years at a cost savings of more than $500,000 per individual. And again, this is largely due to the cost of health care and long-term care. Well, given the state of the science, what recommendations can be made? And again, using Alzheimer's as an example through prevention, there's two kind of bookends on the approach that we could take. So one would be general recommendations based on the available evidence. And Dr. Cooper from George Washington University emphasized that we must have intellectual honesty when we're communicating with patients or the general public on what is the state of the science and not to be over-promising. And in the states, we have another process for our health professionals and federal programs, which is our dietary guidelines for Americans. And this is science-based nutrition guidance, and we also include the national guidelines for physical activity. So as an example of general recommendations, these came out of an international conference on nutrition and the brain in DC in 2013. And during this conference, the speakers were asked to comment on possible guidelines for Alzheimer's disease prevention with an aim of developing a set of practical, albeit preliminary, steps to be recommended to members of the public. And the following principles were applied to the development of these guidelines. They were to be based on substantial, although not necessarily conclusive, evidence of benefit. Implementation of guidelines should present no reasonable risk of harm. And third, the guidelines were to be considered to be subject to modification as scientific evidence evolves. And some of the guidelines that they put forward will be familiar to many of us, such as eating less saturated fats, less trans fats, a more plant-based diet with vegetables, fruits, and grains, and less foods derived from animals, consuming vitamin E from foods and B12 from fortified foods and supplements, and for those taking multivitamins to choose vitamins that have less of some of the oxidant minerals, such as iron. And for the general public or patients that might be concerned about aluminum, what are some ways that could be decreased? And aerobic exercise equal to 40 minutes of brisk walking 3 times per week. And this article has been cited over 50 times, so it is kind of getting out there in the public domain. So another way we look at making recommendations is through our dietary guidelines process. And in 2015-2020 guidelines emphasize an appropriate energy intake, and this would address some of the issues Dr. Hillman brought up about adiposity and obesity. We have long-standing recommendations related to diet and prevention of cardiovascular disease with physical activity guidelines. So only indirectly do these guidelines address brain health. And guidelines will be forthcoming for birth to 24 months in the future, and I would expect that they may be indirect again about brain health. So our dietary guidelines process in the states is founded on reviewing the science through an external advisory committee that makes a report, submits it to our federal government, and the report is informed by systematic reviews, reviews of existing reviews, meta-analysis, I'll get to that in just a minute, and reports by federal agencies or leading scientific organizations. So if the science is strong enough, then that would move on to developing guidelines that are consider public and federal agency comments, and again results in scientific-based nutrition guidance. And then we have a process for implementing the dietary guidelines, and they're applied through our federal programs. So importantly, for our school nutrition programs that could help address some of the issues of nutrition-related problems in our youth, and as well as programs for older people. And then there's nutrition education materials for the public. So I wanted to just follow up briefly on the state of the science regarding meta-analyses, since these are used as a source of information in our dietary guidelines process. And so meta-analyses related to dementia or cognition, Dr. Bernard's group that had the general recommendations cited 3 meta-analyses related to certain nutrients. And in a quick PubMed search for meta-analyses related to dementia, which is a disease, or cognition, which is the functional outcome, in any age, I found less than 15 meta-analyses for search terms such as nutrition, diet, or dietary. And there's a lack of research on dietary pattern analyses, which is where our dietary guidelines have moved toward. And there's a few studies about nutrients, and there's several studies that are diet-related interventions for those with dementia, because people with dementia often have behavioral problems that, whether they're eating too much or not eating enough, and many other issues. So a diverse literature there. And there's less than 25 meta-analyses for physical activity or exercise that I could find. There's over 15, though, for things like glycemic control, diabetes, obesity, and weight loss, which both have components of nutrition and physical activity. So it seems that we have, our evidence is emerging, but really not ready yet for federal guidance, in my opinion. So with that, let's turn back to our panel for some next steps, and I'll invite them to come up front. And unfortunately, Dr. Von Prague had to catch a little bit earlier flight than we planned for, but we do have Dr. Hillman and Dr. Lay here to answer your questions. And please use the microphones and state your name and affiliation. Thank you.